From the Toronto Star, I'm Sabah Itazaz, and this matters. Can you ever measure the weight of grief during this pandemic? Scientists say you can measure it in a way. You can actually calculate the years that COVID took. I know all of us have been reeling from the devastation of numbers this pandemic has slammed us with. Wave 1, 2, 3, infection rates, R naught, number of deaths. It's been more than a year of the numerology of loss. But we're still trying to grapple with the weight of what has been taken. And some scientists say it's trackable through all the time COVID stole from us, all the years of life that those who are no longer with us could have lived. Toronto-based science and business journalist Kat Eschner wrote about this in a haunting piece for the New York Times. She joins me now to talk about the science of measuring lost time and what that might reveal about what we lost to COVID. Hi, Kat. Thanks for joining me on the podcast today.
My pleasure.
Kat, we've all been trying to find a way to measure the meaning and weight of this pandemic, and we haven't quite succeeded. But you wrote in your New York Times article, there's an actual science to this. So tell me about the years of life lost through this, and how can something so complex actually be calculated?
Right. So first of all, I think, and I'm sure we'll talk about this later, I think there are ways in which no calculation can address what we've lost. And I don't think that, it can tell us everything, but it can actually tell us a lot, and a lot more than you might think. I learned about years of life lost, the metric that this story is about, a few years ago. I was actually working on a different public health issue. And basically what this is a way of peering into the future that didn't happen. It's a way of peering into a future where all the people who died in this pandemic didn't die in this pandemic. It never happened. And they still had all of the time that they had when they died to live out and do whatever they were going to do with that time, whether it was, work or care for children or write a book or just, go for walks. Whatever they were going to do with their years, they still had that time. Basically, how you calculate years of life lost is you look at an actuarial table or a public health life table, and you look for someone's conditional life expectancy based on where they are in their lives. So how old they are, what kind of person they are, where they live, that kind of thing. They produce these tables regularly. They're very easy to access. The World Health Organization produces very reliable ones. And then you take the hard number, which is when that person actually died. So let's say someone died at 30, but they were supposed to live to 80. You subtract the age they were when they died from the number of years they could have been expected to live. And the answer that you get is how many years they lost. So basically looking at years of life lost can tell you a lot about what the actual cost of a particular cause of death is. When I learned about this, I was looking at it for the opioid epidemic, and I was looking at it for gun violence in the United States. And those both have huge costs in terms of years of life lost because they're things that kill young people and things that kill people like much premature of where they would have been expected to die anyways.
And this is not a radical new concept, right? What are the other areas or industries that already use this parameter of years of life lost?
Yeah, no, this isn't a new concept at all. They're used both in public health, especially international public health, and they're used in the insurance industry. So years of life lost actually originated in the life insurance industry always hard to tell exactly when a concept came about, but the oldest publication I've been able to find about it is from the late 1800s. And basically it was a way of figuring out how much to charge for life insurance because it was a way of calculating the payout. So if you could expect someone to live a really long time and they died very prematurely, that's a much bigger life insurance payout than if, someone was near the end of their theoretical life expectancy.
So it's sort of like a way to assess potential, right?
That's exactly correct. So it is a way of measuring lost human potential.
Kat, you write about a groundbreaking international study that has literally calculated years of potential life around the world during this pandemic and during its consequences. How did they come up with that in terms of the methodology? And do you have like a rough estimate? How many years have we lost globally to COVID-19?
It's a really interesting question, actually. So how they came up with it is they used these two big databases. One is a long-running database called the Human Mortality Database that also now has COVID-19 info in it. And there's another one that looks specifically at COVID-19 deaths around the world sorted by age. Age is, of course, a really important part of calculating this metric. The Max Planck Institute for Demographic Research in Germany was involved with creating both of these databases, along with more than 100 demographers, health economists, and statisticians from literally every occupied continent of the planet. It's good to give them credit for their work. The widely reported number that this study came up with was more than 20 million years of life lost over the 81 countries studied in 2020 from the COVID-19 pandemic. They figured out that the cause of death, like COVID-19 is a cause of death, was several times higher than flu. You lost a lot more years to it than flu. So it was a way of disproving the kind of argument that, this is just a flu.
More than 20 million years of life lost. These numbers are just too huge to process. How do we even translate them? How has this kind of been broken down by the experts?
I've been working on COVID-19 since the beginning. I was reporting regularly for a variety of outlets since the beginning of the pandemic on the pandemic, on COVID-19. And the whole time I've been really preoccupied with these twin problems of scale and meaning. So it's too big for us to think about, but it means things that are really hard to grapple with because of the size of the issue. So one way to cut this down is those ratios that I was talking about, where some researchers have been able to figure out, how many times more impactful, how many times more deadly COVID-19 has been than other causes of death. That's one way you can sort of break it down. But I was really interested in not just the ways that public health researchers can break down all this death, all this loss using years of life lost, but in the sort of the meaningfulness of something that, rather than talking about deaths, talking about lost time, the thing that we really mourn with people. I was really interested in the kind of the weird space between this very sterile public health metric and what it would actually mean to have that time that's been.
Which you mentioned in your piece as well, how in the insurance industry, these numbers are translated into money and public health experts refer to them as burden of disease. But you're looking at it in terms of loss of opportunity, maybe opportunity to raise a family, build a house, be part of a community, basically live your life. It's really hard to quantify that, I think.
Yeah, well, it's hard to quantify, but it also isn't, I think. Although it might seem simple, and although it might seem to say a lot, death is a really imprecise metric because not every death is the same or means the same thing, which isn't to say everyone's life isn't equally valuable. That's not what I'm trying to say. What I'm trying to say is there is a big difference. Again, at a population level, there is a big difference between many people dying at 20 and many people dying at 80. And being able to probe how old people were when they died and what that actually means allows us to make more informed decisions about how to save lives, but also how to save time, how to save sort of long-term public health impacts. Because if someone dies at 20, say, and again, I'm just speaking at a population level, not about an individual person, but if someone dies at 20, that means something very different in terms of all the things they would have done with all that time than if someone dies at 80 or 90. When they have lived a large span of their lives.
Right. That was actually going to be my next question, because you mentioned a lot of health experts who are pushing to use this calculation of lost years along with just the number of deaths. So I wanted to ask why they think it might be more important to track this time that we've lost to the pandemic rather than just the lives, the number.
So again, the number it doesn't really tell us much of anything beyond the fact that many people died. For instance, using years of life lost can let you discover some really surprising things about the impact of this pandemic. For instance, that if you look at deaths this is in the US, not in Canada, but if you look at deaths among even the oldest people who died of COVID-19, just among the oldest, that burden, just because so many of them died, is really, really big. It's bigger than the other burdens for a full population. So it justifies measures to protect those people, like vaccinating them first.
Like better public health measures, for instance.
Yeah, well, it leads to better public health measures because it lets you see where the most life is being lost rather than where the most people are dying.
We'll be right back. Does does it also help clear some of the misconceptions and kind of expand a sort of narrow view that we might have on COVID-19? Because you mentioned some experts who said it's dangerous to just look at this pandemic through just the mortality statistics. So how does this kind of help to clarify a lot of that?
Right. So one of the researchers I talked to for this, whose work I worked on, he got really interested early in the pandemic. Like I think many of us who study public health in some way got really interested in the way the COVID-19 conversation came to center around deaths really quickly. So basically, he was really interested by the fact that at first, during the first lockdown, everyone was like, we've got to flatten the curve. We got to prevent deaths at all costs. We got to keep people from getting this disease. And then very quickly, the sort of public narrative shifted to, and, it's very morbid to say, but, these people who are dying, they're old people who would have died anyway, or who didn't have much life left to live. He was able to show in his work, and this is Andrew Briggs, that even the oldest people, they died at such a number that they were contributing a really substantial burden of lost life to the public health system. And they were contributing on a social level, a huge burden of lost time. I was actually surprised by that finding in a way, because I was thinking also okay, so if we're only counting people who are, say, 85 and above, I wouldn't expect that those people would have much time left. So I wouldn't expect that the burden, even of all of those people who died in that age bracket, would be huge. But it actually is. It's really, really big. And that's for two reasons. One, it's because many people died, but also because the people who make it to 85 are very likely to make it much farther. So in the piece, I talk about a 13-year-old girl named Anna Carter. And her life expectancy at birth was almost 78 years. If Anna had made it to, say, 60, her life expectancy would have been longer, because conditional life expectancy, how long you can be expected to live, is directly related. And this is, again, a population level. It's directly related to how long you've lived already. If you successfully made it to 30, the likelihood that you will successfully make it to 50 is much higher. The likelihood that you will then make it much higher in age is much more likely.
I do want to come to Anna Carter's story later as well, but in your piece, you mentioned studies tracking the loss of younger people and family members across various countries. Can you paint a brief picture of what was found? And you talk about how this is going to affect us for generations. So are we looking at a pandemic of bereavement in the coming years?
That's a really interesting question. So for starters, I'll start with the people of color piece. And put bluntly, in the US, which is where the study I was doing took place, but I would expect to see similar. I don't know that I would expect to see the same magnitude in Canada for a bunch of reasons to do with our health system and the way we handled the pandemic so far. But in the US, in the first phase of the pandemic and continuing, it seems that, people of color, just put broadly, lost many times as many years as white people. And like everything else with this metric, a big years of life loss number, when you're looking at a specific population, usually means, and in this case, it does mean, that both more people died in those communities, which we already know from looking at death statistics, but also younger people died. People died younger. They lost more life. They lost more time they could have had with their families, with their communities. They lost more time they could have spent teaching people things. They lost more time that they could have spent, working, which is a common way to use this metric. They just lost a lot more time. So recent data from the CDC, that's the Centers for Disease Control and Prevention in the US, shows that Black and Latinx people in the United States are dying at a rate that is between 1.9 and 2.3 times higher than that of white people. But if you look at these ratios, the ratios of death, the Harvard researchers I talked to found in this study, they found that Black people under the age of 65, and they had a really conservative cutoff age of 65, lost 4.6 times as many years of life as white Americans. And Hispanic Americans lost 3.2 times as many years of life. So that's a much bigger loss just for all of those people. But then if you look, you get a little more granular and you look at people in the age groups from between 25 and 54. So people who would be, we would expect would be, having children, they would be working, they would probably be very active. Those are very active years in most people's lives. They lost as many as 9 times as many years as white people in that age bracket. So that's 900%. That's a staggering figure. Dr. Mary Bassett of Harvard, who was the one who led this study, she was talking about exposure and how exposure played a key role because, who was still working during the first phase of the pandemic, who was on public transit, who was living in multi-generational housing, who didn't have the resources to stay home when they were sick. And in the US, that means people of color.
And in Canada too, as you're finding out through a lot of the race-based data that's coming out, right?
Yes, absolutely. The only reason I'm talking about the United States specifically here is because I want to stick close to the source material. And this was written for the New York Times in the United States. I would expect to see this like similar dynamics in Canada, although I think the exact numbers would look different for reasons to do with our population and its distribution and, a bunch of other factors.
Absolutely. And these are mind-blowing numbers. They are also saying a lot about, like you said, how we handle the pandemic, but also the state of the world today and the inequities and inequalities therein. These are numbers, statistics, calculations, and through them, we're trying to process in some measure what has happened to us, what COVID has done to the world. And that helps, I guess, to learn some lessons and do better. But do you think we can ever find a way to capture the weight of this human loss and this reckoning that we're experiencing? I think you tried to explain that a little bit through the heartbreaking story of Anna Carter.
I think I'll just take it back to death for a second, because there's sort of an important way we can talk about the effect of a death number versus the effect of a years of life loss number and what that actually lets us see about the emotional impact of the pandemic. Just looking at the pandemic through a mortality statistic obscures what's actually being lost, for starters, as we've discussed, all this time that's being lost, but in a way that has a huge emotional impact. Death is a big, scary idea. People sort of shut down when they start thinking about it. But for those left behind, what we mourn when someone dies, what we miss, what has social and economic impacts is the loss of all the time that that person didn't have. I wish I had said this to this person, or I wish I had had the time with this person, or, I wish that this person had been able to see their grandchild, things like that. That's what we mourn. We don't mourn the death. The death is sad. And for that person, the person who died, it's a huge thing. But for those left behind, what we actually miss is all that time.
Time lost, potential life lived. Is that what you tried to capture through the story of Anna Carter, who you mentioned had a life expectancy of 60 plus years, and then COVID happened?
Exactly. So when I was writing this piece, I wrote a lot of drafts of this piece. I don't normally write as many drafts as I wrote here. I was initially very hesitant to use a single person and to use the story of a single person to kind of bring us into this world, because statistics tells us a lot at a population level, but not a lot at a personal level. Again, my relative life expectancy or yours don't actually tell us much about how long we're going to live, because so much determines when someone lives and when someone dies. Anna Carter was exactly the same. But as I was working through the story, I realized this loss would only stop being abstract when we talked about it in terms of a personal loss, because that's actually what we're talking about. We're not talking about death. We're not talking about abstract years and economic distribution. We're not talking about that. What we're talking about is the lost time that people have with one another and all the things that they do with it. I reached out to a bunch of COVID-19 grief groups. I didn't want to approach people individually because I didn't know how I didn't want to cause them extra grief. I wanted someone to come to me. And I got a few responses. And the one that ended up working out was with a woman named Amber Carter, who lives in Oklahoma and had lost her middle daughter, Anna Carter. And Anna was the first child to die of COVID-19 in Oklahoma. She was 13 years old. She died very suddenly. She wasn't sick for very long. And this was sort of in the early phase of the pandemic when a lot of things weren't very clear. She had 4 brothers and sisters were left, and her parents, of course, were left to process her loss in the midst of this pandemic. And Amber Carter, her mom, was very generous with me with her time and told me a lot of things about Anna. We talked about her life. We talked a bit about her death. And we talked about what she might have done with her life. And, for a 13-year-old, it's hard to know when you're talking about someone that young, what they might have done with their life because they had so much time. As I wrote in the piece, her life expectancy at birth was 77.9 years. So even going by that, which is not a conditional life expectancy, that's just the one she had when she was born. She had so much more time left and so many things to do with it. And she wanted to become an entertainer of some kind. She was studying dance. She wanted to be an entertainer. Then her backup plan was medicine, which I thought was kind of a neat thing about her. But she had all this time. She could have done, she might have done one of those things. She might have done something else. She might have had a family like she wanted. She might have had a big family. She might have gone in a different direction with her life. Like, we can't know. Like everybody who died in this pandemic, she had a ton of potential. And I think the death of a child is always a particularly heartbreaking and particularly affecting kind of death, because children do have all this time and they do have all this potential. And she was right at the cusp. She was almost ready to go to high school. She was like just beginning her adult life. But we can say with a fair amount of certainty that over the next couple of years, she would have gone to high school. She was really looking forward to starting babysitting. She was going to start studying jazz dance along with the other kinds of dance she already studied. Her brother, who was 2 when she died, would have grown older. Her family they were planning to move back east, probably to Connecticut, New York State, somewhere like that, to be closer to family. They might have made that move when her dad retired from the military. And now it's like her life, she will never do whatever it was she was going to do, but also her family has been deeply affected by this. Her siblings, their lives have been changed. Her parents have chosen to stay in Oklahoma, stay near where she's buried, and they plan to be buried with her when the time comes. When you think about that loss, multiplied by all the times people died in this pandemic and all the ways that changed all the lives of the people they knew and loved. When you think of this one family, they are part of a much bigger sort of demographic shift and a much bigger, series of changes occasioned in our lives by this pandemic.
And I think that perfectly encapsulates the fact that neither the total number of deaths or the years of life lost can truly capture the cost of this experience. And that gives us an insight into what we're dealing with in this pandemic. Thank you so much for trying to wrap up such a complex topic into the few minutes that we had.
Yeah, thank you. This has been wonderful.
I was speaking with Kat Eschner. She's a science and business journalist from Toronto. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mudhir. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by SoCalled, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.